patient safety in the forefront, as we have always done. We have seen a lot of changes in our hospitals and the algorithms and the pathways in the physical layout of the hospitals over the last several weeks to make it safe for patients to re-engage back into the hospitals. And as Dr. Mark said, we are starting that process as of today of the community coming back into the hospital for routine hospital care. Some of the changes we see in the offices as we start to reopen our offices, even as early as today, we have rearranged our schedules. We're spacing out patient care in the offices, so patients come in as an individual appointment and won't run into anybody else. The waiting rooms have been changed, so chairs are spaced out, so if a patient does come in and there are other people there are places to sit, so you're not next to anybody. We continue to limit visitors through the offices as we do in the hospital, so there aren't as many contacts in the offices and in the hospitals, limiting that potential infectious contact. All patients are screened prior to coming into the office to make sure there are no signs, using CDC guidelines questionnaires, that there are signs of COVID-19 or other illnesses, and we extend that to our staff, our physicians, our extended providers. Every encounter is screened. Every person that comes through the offices and through the hospitals are screened appropriately to make sure we're not bringing anything in to our facilities. Extra time has been allotted throughout those appointments to allow for all of the offices to be cleaned appropriately. So once one patient is leaving, every surface area that's touched or come in contact is clean, so the next patient comes into a completely sterile environment. And we continue to offer our virtual visits through the office, so somebody that doesn't want to come in, somebody that can't come in or isn't quite ready, can still have a full encounter with their physician through the office through a video platform, and when the time is right, can come into the offices. In the hospital, we've taken a lot of the same precautions. I think you heard Dr. Marks and Dr. Katz mention that every patient that comes into the hospital through the emergency room is tested for COVID-19, so we know that status immediately. We know where those patients are going. We do have separate units, as Dr. Marks mentioned, for patients that are COVID positive, and we separate them from the units that patients are going to go to that do not have COVID-19. The staff that takes care of those patients are separated from other units as well, so we are eliminating that exposure. We have the same limitation in family members coming through the hospital, so again, to limit that encounter as patients make their way through. And as we start to reintroduce procedures in the hospital, operations, interventional procedures, diagnostic procedures, and so forth, we've taken a lot of those same precautions. This center that you're standing in here is one of our new pre-admitting testing centers, like Dr. Morris mentioned, and these are going to be available throughout the entire Memorial Healthcare system that patients come to in advance of coming to the hospital. They get pre-registered, they get pre-checked in, they get their labs, they get to meet anesthesia, pharmacy, and ultimately we'll get a COVID-19 test so that we know that everybody coming in is COVID-19 negative. If someone does test positive, obviously an algorithm there to make sure that they're either treated by the primary care physician or needs to be brought in if appropriate. On the day of the procedures, patients are escorted to their diagnostic units where they're already been checked in for their procedures, have their procedures, and again escorted back to their family members. Every physician, nurse, staff, and employee member in the hospital is as well being screened and temperature checked to make sure that we are not bringing anything into the hospital. So we're doing everything we can to protect our environment. The hospitals are safe, as Dr. Marks mentioned. None of these things that we have been treating for the longest of times goes away because there is a pandemic, and we recognize that, and it's time for us to get back to treating the community as Memorial has always done. We've made a decision to start the process in a slow and very calculated fashion, starting with elective procedures, and as we move forward, we'll be evaluating the process to make sure we're not using vital resources, things that we need to treat our community that still has a pandemic ongoing, and yet we can still take care of the community the way that Memorial does. I appreciate the time to share this with you. Thank you.